Good morning, everyone, and Happy New Year. Happy 2021. I think we're all glad to say that. I'm joined today by Dr. Morrison and our Chief of Nursing, Marion Dowling, so we'll do our briefing as has become customary on Tuesday. But let me just begin that off the top that as with all New Year's, the freshness of a new calendar year brings with it a renewed sense of hope and of optimism. And I don't believe that hope and optimism has ever been more relevant or needed than it is now. As Premier, I have great expectations for 2021, and I hope all Islanders do as well. We have many reasons for this. We are leading the country in administering vaccines per capita, and it's our intention to keep our foot on the gas pedal. Yesterday, Public Health, as you all know, started administering vaccines in our long-term care facilities, and by the end of January, we anticipate having the first dose for all long-term care residents completed. That's another important milestone for Prince Edward Island. A month ago, it seems like a lifetime ago, on December 6th, we implemented a circuit breaker to stop the spread of COVID-19 in our province. The measures were strict, but Islanders listened and acted accordingly, and because of this, those measures worked. Since that circuit break, we continually monitor things and are working in essentially 2-week increments to ease our way back. Today, Dr. Morrison will be speaking to the further easing of some restrictions within our province that will come into effect tomorrow morning, but will involve an increase in the number of cohorts for gathering and events, which I know many Islanders will be glad to hear. This week, we also welcome back all of our students into our schools. I want to especially thank the students and teachers from our 4 Capital Region high schools who quickly reverted to at-home and online learning during the circuit break, showing once again that Islanders, in the time of difficulty, respond in a positive, constructive, and determined way, and providing further proof once again that this is why Prince Edward Island is the greatest place in the world to live, work, and raise a family. One of the questions that many Islanders have been asking is around the reestablishment or the reconnection of the Atlantic bubble. I think it's safe to say that all Atlantic premiers see the importance of reestablishing the Atlantic bubble as soon as it is safe to do so. We have and continue to rely on our individual chief public health offices for advice on this. And as of today, from a P.E.I. perspective, and it's important to remember that P.E.I. is only one of 4 who make this final decision, but we don't foresee the reestablishment of the Atlantic bubble anytime before January 25th. I say this for probably 3 key reasons. First of all, that we continue to monitor the potential increase of cases because of holiday and New Year's Eve gatherings. A big concern we had, as all Islanders know, heading into the holiday season was the fact and realization that more people were moving around, more people were gathering in larger numbers, and more people were returning home or coming into our region from outside of the region. So we need more time to see what impacts that could or will have. And we have seen other jurisdictions see a spike in cases connected to holiday gatherings. So we need to continue to monitor that to have a level of confidence before we could move forward on any major decisions in that regard. Secondly, the rise in cases that we're seeing across the country and around the world suggests that we need, as a province, to continue to exercise a high level of caution in our province and in this region. And thirdly, which is a good part of this, is that the additional time will allow us to continue to roll out our vaccine rollout distribution plan within our health and long-term care facilities, which Dr. Morrison and Marion will talk about in a moment. But this will eventually and will continue to give us a greater level of confidence and also protection, which is important. So. And before I turn it over to Dr. Morrison, I think that even though we live with some continued public health requirements, and we still have some significant travel restrictions within our province, we can't forget how lucky we are as a province and as residents of a province. Prince Edward Island is seeing more flexibility than other jurisdictions. And I just want to continue to remind and encourage Islanders to fully recognize that it's also very important we don't take this for granted. If there's one thing, one cold hard fact we've learned about our lives during this time of COVID is that things can change very, very quickly. So we can't let our guard down, and we have to continue to be mindful. But we are fortunate to live with the situation that we have here in this province. And I know each and every province across the country is envious of Prince Edward Island. So with that, I will turn it over to Dr. Morrison for her daily brief, and then on to Chief Nurse Dowling.
Good morning, good afternoon, Happy New Year. And I do think we have lots of reasons to be hopeful and optimistic as we start this new year. I hope everyone has had a safe and peaceful holiday. And I know the holiday season was different for all of us this last year. And thank you to Islanders and visitors for adjusting holiday plans with respect to public health measures. And we are grateful for your cooperation and understanding that has been shown by everyone throughout this pandemic and especially during this holiday season. Today I'd like to talk about the COVID-19 and P.E.I. in Canada, the vaccine, briefly on the variant of COVID-19 and the post-circuit measures in place that we have spoken about before, and a few highlights from 2020. There is one new case of COVID-19 to report today. This individual is a female less than 19 years of age with a history of recent out-of-province travel. Contact tracing is complete, and this person is self-isolating. We currently have 4 active cases who are isolating at home and are being followed daily by public health. Since the pandemic began, we have had 97 cases of COVID-19. Globally, COVID-19 continues to have a devastating impact in many countries, with over 85 million cases and 1.8 million deaths. The United States has reported over 20 million cases and 350,000 deaths related to COVID-19. The U.S. is currently averaging over 200,000 new cases per day and more than 2,500 deaths per day. The situation in Canada continues to escalate, with a total of over 600,000 cases and over 16,000 COVID-related deaths. In the past week, case counts were up in Manitoba, Quebec, Ontario, New Brunswick, Nova Scotia, and Newfoundland and Labrador. And overall, a 6% increase in cases in Canada last week. So in Canada, the worst of COVID-19 may not be behind us. Our last 100,000 cases were recorded in the past 2 weeks. To put this in context, our first 100,000 cases were recorded in the first 6 months of the pandemic. This virus continues to take a toll on individuals and families. Health systems in many jurisdictions are under significant strain, and the impacts of COVID-19 are real and far-reaching. Healthcare providers and professional associations in many jurisdictions are pleading with citizens and decision makers to support and implement measures to protect healthcare systems from additional demands related to a surge in COVID-19 cases. At this point, Atlantic Canada, including P.E.I., is in an enviable position compared to our provincial counterparts out of the Atlantic region. Most other provinces would dearly love to have a rate of total cases similar to P.E.I. I have been asked why P.E.I. is doing so well in comparison to many other provinces, and I don't think there's one single answer to this question, but rather a number of factors. Islanders have been very cooperative and compliant with the public health measures. Islanders have demonstrated they will follow these measures and adapt well when the guidelines change. We would not be in the position we're in today without the steady and unwavering commitment of individual Islanders and businesses. As well, border measures, including pre-travel approval, border screening, Operation Isolation, have been key in helping us limit the importation and transmission of the virus. Testing is another key element. P.E.I. has tested 512 people per 1,000 population compared to the Canadian average of 374 per 1,000. P.E.I. is second only to Ontario in testing per capita in Canada. And when we've had clusters or outbreaks of COVID-19, we have relied on the basics of communicable disease control, including early detection, isolation, testing, contact tracing, and quarantine. Our understanding and patient approach has been balanced with enforcing the legal requirement to limit gatherings and to self-isolate. Currently, we are doing well. However, we know one super spreader event could change our situation dramatically. There is an increasing number of cases of COVID-19 in Canada linked to the UK variant strain of this virus. Early reports demonstrate an increase in the transmissibility of the variant compared to other circulating strains of COVID-19. In other words, this variant spreads more easily from person to person. There is no evidence the variant is linked with increased severity of disease or mortality. However, research continues to determine the health impacts of this variant. The swabs for all our positive cases in P.E.I. are routinely sent to the National Microbiology Lab for sequencing. None of our 97 cases have been identified as the UK or South African variant. We continue to monitor the situation and participate in discussions with federal and provincial colleagues. On Friday, December 18th, we entered a 3-week post-circuit breaker measure as a post-circuit breaker phase as a first step towards easing back to the new normal phase. At that time, it was also announced that P.E.I.'s participation in the Atlantic bubble would be suspended, at least into January. So today, as the Premier mentioned, we'll be easing some further restrictions in a step towards getting us back to that new normal. And these measures will come into effect tomorrow, January 6th at 8 a.m. We will continue to monitor the situation with the aim of being back to the new normal by January 25th. These include personal indoor and outdoor gatherings will continue to be for household plus 10 consistent individuals as much as possible. Organized gatherings such as concerts, worship services, and movie theaters can occur with 50 people with 2 additional multiples of 50 permitted with an approved operational plan. Weddings and funerals will remain at 50 people plus officiants and will not be eligible for additional multiples of 50. Organized recreation and team sports will resume subject to the limits for organized gatherings, so 3 cohorts of 50 people. Tournaments are allowed, provided the total number of people mixing over the span of the day does not exceed 50. Prior approval is required for any sporting events involving more than 50 individuals. And participation in any post-game tournament activities is restricted to individual teams. In-room dining at restaurants and licensed premises will continue to be open until 11 p.m. with a maximum table size of 10 people. I'm also confirming, as the Premier mentioned, that the Atlantic bubble and our participation in that would be suspended at least until January 25th. And as our colleagues have said in other parts of Atlantic Canada, now is not the time to reopen the Atlantic bubble. But I know we all want it to happen. As I've stated previously, these new measures represent a balance. Further movement towards the new normal with some caution to allow us that necessary time to determine if there are going to be increased cases of COVID-19 related to the holiday season. And although other provinces and jurisdictions around the world are implementing strict measures to contain transmission of COVID-19, we are in the fortunate position of being able to slowly and cautiously return to our new normal. The rollout of COVID-19 vaccine is a huge and complex task for P.E.I. in Canada. It will take weeks and months to vaccinate all islanders. The good news is that we are off to a very good start. Over 1,900 healthcare workers received their first dose of the vaccine in December, and beginning this Wednesday, these workers will begin receiving their second dose. And yesterday marked another significant milestone in our fight against COVID-19. The first vaccine was administered to residents in our long-term care facilities. 170 residents and staff at Whisperwood Villa were vaccinated. By the end of the week, over 1,000 residents and staff in other private and public long-term care and community care facilities will receive their first dose of the vaccine. We anticipate that all long-term care and community care residents and staff will receive their first vaccine within the next 3 weeks. And I know we'll all feel better when this group is immunized and protected against COVID-19. As soon as the long-term care and community care sector is immunized, and it is a reminder, it is a 2-dose vaccine for both our products, our focus will turn to vaccinating others in congregate living situations, including group homes, community residential facilities, and shelters and other priority groups. By the end of March, we anticipate that everyone living and working in long-term care and community care and other congregate living arrangements, as well as healthcare workers who provide direct patient care, will be fully vaccinated. And subject to vaccine supply, we also hope to start immunizing those over 80 living in the community and rotational workers and truck drivers before the end of March. More information will be provided to Islanders in the coming weeks regarding these vaccine clinics and how to schedule an appointment. Our supply of vaccine is confirmed until late February, and we anticipate receiving an increased supply of vaccine in the spring. There have been recent questions about using the Pfizer vaccine for long-term care residents. Initially, jurisdictions were advised by Pfizer to not move the vaccine from the location from where it was delivered. Since then, jurisdictions have been given authorization to move the Pfizer product. So initially, we have opted to move that Pfizer vaccine to locations within the greater Charlottetown area. And later this week, when we move to facilities and other communities, we'll be administering the Moderna vaccine product. Both the Pfizer and Moderna product are excellent vaccines approved for use by Health Canada. The important issue is getting the vaccine and not which vaccine is being administered. Knowing that Islanders are receiving the vaccine gives us hope. The immunization signals that things are going to get better and life will return to normal when this pandemic is over. There will be vaccine for all Islanders who want to receive it, and although it will take time, it will take months for everyone to be vaccinated, Islanders all can be assured that their turn will come. We are fortunate to have good access to vaccine, and we are working with our partners to mobilize resources to distribute available vaccine based on national recommendations. If anyone has questions about the vaccine, please visit the provincial COVID-19 website. And similar to our testing data, we will be posting information on a weekly basis on the number of people vaccinated. And we also report this information nationally, and we are working to update that as soon as possible. We owe a huge thank you to our federal colleagues for procuring and distributing vaccines to all jurisdictions, and a special thank you to Health P.E.I. and long-term care partners for setting up these first vaccine clinics. And just as we finish up, I think it was a time to reflect back on the events of the last 10 months and many things that we've accomplished through our efforts at keeping Islanders safe. And we've screened over 250,000 non-commercial vehicles, both out Wood Islands and Confederation Bridge. Border screening staff have denied entry to 1,250 individuals for reasons related to not having pre-travel approval or proper documentation or identification. Over 15,000 households have completed 14 days of self-isolation in P.E.I. We know we have just this for the winter semester, 785 post-secondary students have applied to travel to P.E.I. We've had over 24,000 calls addressed by the 1-800 line, and 2,600 COVID inspections have been completed, and 3,600 operational plans reviewed. And there are many more certainly numbers there to give, but those are a few. We would not be able to achieve these results without the support of Islanders. The collaboration and assistance of many partners across the public, private, and not-for-profit sectors is allowing us to sustain our comprehensive provincial pandemic response. Thank you to everyone involved in supporting efforts to keep Islanders safe from COVID-19. And as we turn over the page to 2021 and look forward to this new year, we can be confident that P.E.I. is well positioned in our fight against COVID-19. We will stay the course and focus on limiting the importation of COVID-19 into P.E.I., and if we get cases, we will focus on containing transmission. The national media has referred recently to COVID-19 as a firestorm that's happening across the country, And we must do all we can in COVID-19 not to let it catch fire here and keep it out of our province and to limit the spread. So with renewed hope and optimism as we continue this COVID-19 journey, let us continue to be patient and continue to be kind. Thank you.
Well, Happy New Year, everyone. And like most people, I'm happy to enter into 2021 and see 2020 in the rearview mirror. We know there is still quite a road ahead of us to continue to manage our way through this pandemic together. Our testing are back to regular hours at all locations. And just a reminder of how important it is that people who have symptoms of COVID-19 or are otherwise required to be tested continue to come to the clinics. Testing is available by appointment or on a drop-in basis, and times and locations are available on the Government of P.E.I. COVID web pages. I want to thank Public Health Nursing who've been coordinating the vaccine rollout with Dr. Morrison's office. And this week, as we heard, it's extended into our long-term care homes, which is an exciting milestone to be achieving here in PEI. Thank you as well to other nurses and healthcare providers who have offered their assistance to support the vaccination program moving forward. We know how important it is to have the most vulnerable populations vaccinated as soon as possible, and public health nursing and our entire health system is committed to providing immunizations as quickly and efficiently as possible. Just a reminder that it is important to continue to seek health care if you're not feeling well. People with cold and flu-like symptoms can call their family doctor or nurse practitioner or 811 to be referred to our cough and fever clinics, where they'll be assessed and receive treatment. If you're in need of emergency or urgent care, please go to our emergency department near you or call 911. This can be a difficult time of year as we turn the page on a new beginning of a new calendar year, and mental health and addiction services are also available for you. The new bridgethegap.ca website provides information about all levels of mental health services in PEI, including care provided by Health P.E.I. and our community partners. It's an excellent resource, and I would encourage anyone needing this type of support to look at that resource. You can also call the Mental Health and Addictions Information Line, which is 1-833-533-9333. Calls are answered by trained mental health and addiction staff and are available from Monday to Friday from 8 to 4 p.m. Our mental health and addiction staff offer a broad range of services, including walk-in clinics, to help support Islanders. I just want to end by reiterating some of the Premier and Dr. Morrison's comments of thanks to our visitors to PEI, as well as all Islanders who continue to follow the public health guidelines, keeping circles small, wearing your masks, staying home when you're sick, getting tested when you have any symptoms. We truly couldn't be here without everyone's support and cooperation. We appreciate your patience with us as we continue to move forward through the rollout of vaccine, and we will do our best to get this out as quickly and as effectively as we can. Thank you.
Well, thank you both. That's exciting news. And also, I guess we will turn it over now to questions from our friends in the media.
Steve Bruce, CBC.
Yes, hi there. Happy New Year to you all. Dr. Morrison, can you lay out again specifically which restrictions are easing or changing tomorrow morning? And then I guess talk about why you decided to make those changes versus easing other restrictions. And can we expect any more changes before January 25th?
Hi, Happy New Year. So really the biggest changes is in terms of the multiple gatherings, and so there are a number of reasons, and to answer parts of your question, I think we're looking at wanting to do it carefully as we open up and ease up the restrictions over the next couple of weeks. We've wanted to be very cautious, as the Premier mentioned, with students arriving in the province, Christmas travel, Christmas and New Year's gatherings, so we don't want to go too quickly. We recognize that in some ways, where is the epidemiology? So a lot of the transmission around the gatherings may be more in personal gatherings. So we felt that we could move a little more quickly with giving an extra cohort to some of the events and for recreational sports and for churches. And that's primarily the biggest change. And I think you'll see, consistent with what is happening in our other Atlantic provinces, not wanting to make too many of the other changes around in-room dining, curfews at 11, again, to see what happens in this province, and hopefully we don't see a spike in cases, but wanting to make sure we're careful in case that happens. So those are a couple of points, I think, in response to your question, Steve.
Thanks so much. And with this new Pfizer guideline that says the vaccine can be transported more easily from its storage site, how much of a game changer is that for the province? How does it change PEI's vaccine rollout?
Well, I think it's been very helpful, not only for us in Prince Edward Island, but in other parts of the country as well, because it means that we can use this product not just at a clinic at the hospital where it gets delivered. So it can be transported, and that's why we started with using it in some of the long-term care facilities in Charlottetown, so that we're not transporting it long distances. So I think it allows more vaccine to get into long-term care facilities and out to community care facilities. So I think that's a good thing. We do have anticipated number of doses of Pfizer vaccine over the next 2 months, and this will allow us to use both the Pfizer product and the Moderna product in this province.
Thanks so much.
You're welcome.
Julien Lacacha, Radio-Canada.
Bonjour à tous et bonne année à vous trois. Question pour vous, Dr Morrison. J'aimerais revenir en particulier sur la bulle atlantique. Est-ce que le fait que le Nouveau-Brunswick et la Nouvelle-Écosse ont annoncé beaucoup de nouveaux cas lors de la fin de semaine dernière, est-ce que ça a fait évoluer votre décision, et c'est pour ça que vous parlez aujourd'hui maintenant du 25 janvier?
Oui, mais bonne année. C'est une des raisons, Nouveau-Brunswick, la Nouvelle-Écosse ont plus de cas. Et puis, on veut attendre pour voir si on a aussi, ça augmente le nombre de cas ici à l'île du Prince-Édouard. Mais bien sûr, si on voit les cas qui augmentent au Nouveau-Brunswick, comme exemple, on veut s'assurer qu'ils ont un bon... ce qui va arriver au Nouveau-Brunswick, à Nouvelle-Écosse, pendant cette même période de temps. Je sais qu'on veut tout recommencer, la boule atlantique, mais ce n'est pas le temps encore, mais j'espère. Je sais que tout le monde veut que, à un moment donné, on peut refaire la boule atlantique.
Docteur Morrison, je vais poser cette question en anglais parce que j'aimerais avoir votre réponse en français, mais peut-être aussi celle du Premier ministre Dennis King. I'm going to ask this question in English. What is your timeline? What is your goal to reopen that Atlantic bubble? Do you want to reopen that like as soon as possible, like maybe February, or because there's no tourists, in this season, so maybe you can wait a little bit further, maybe just the spring?
I can start. I think as I articulated in my opening, that I think all of us would like to open to the Atlantic region again when it is safe to do so. And I think that, there are a number of people who travel within the region for various reasons, or who would like the opportunity to do so without the need to self-isolate upon return. So that's something that we take seriously, and we do, contrary to what many might think, there is a pretty brisk regional tourism growth sector here over the last number of years, primarily within the region, that would be most helpful and we'd be most interested to open to. But, as I said, we're one of four. The conversation I've had with Dr. Morrison, and we've had very many over the last number of days, is just that January 25th would be the first date that we would feel a level of comfort but we're one of four. We have to look at what's going on in other regions as well and respect where they're at and what advice they would have. But, I think we want the free movement of people throughout the region for sure, and hopefully at some point soon beyond that. But we've been erring on the side of caution for a reason. It's been helpful to us. It's kept our caseload relatively small, and we'll just continue to do so. But I think it's safe to say we'd like to have this open as soon as it's safe to do so.
I agree. I think the only thing I would add is that, we know the Atlantic bubble worked very well for, I think it was five months. We recognize the connections, as you mentioned, a lot of family connections as well in the Atlantic Canada area, and so we'd like that to get there, but it is a decision that is made in conjunction with the other provinces, and I know they also are wanting to make sure their border measures are for those coming in outside of the Atlantic area are in a good place as well. Alors je vais essayer de dire ça en français aussi. On sait qu'il y a les connexions entre les provinces maritimes et atlantiques et on a toutes sortes de connexions entre les provinces et on voyage et on aimerait ouvrir quand on sait que c'est sécurité d'en faire entre les provinces atlantiques j'espère qu'on peut faire aussitôt que possible, mais seulement quand c'est une décision entre les provinces d'en faire. Et puis la boule atlantique a fonctionné très bien je pense que c'était 5 mois. Et on espère d'être là encore une fois.
Merci beaucoup. Thank you.
Stephanie Kelly, CBC.
Hi there. I have a question for Dr. Morrison. You mentioned that there's vaccine supply confirmed until late February, and you anticipate getting more in the spring. I'm just wondering if you can give us any more specifics on how many doses we can expect in the next coming months, and also when you expect sort of the more general population to expect getting vaccinated here in PEI.
Yes. So we have numbers confirmed in terms of doses over the next 2 months confirmed, and then we anticipate having a confirmation of additional numbers in March. But we have 975 doses per week coming in with the Pfizer product, and 2,400 doses of the Moderna product coming in per month in January and February, which is actually more than we had initially anticipated. And those will come in 2 shipments in January and 2 shipments in March for the Moderna, or in February for the Moderna product. And again, we expect to have confirmation of additional numbers in March. And we are hopeful and awaiting numbers for a large increase in numbers of vaccine in the springtime. So I mentioned a large number of groups that we hope to start vaccinating over this first quarter, and that's that January to end of March period. And then as we move into April, we will be doing those we start with those who are 80 and over, hopefully by the end of this first quarter, and then we'll be moving to 75 and over, 70 and over, into other healthcare workers that are outside the front lines of COVID and direct patient care, but other healthcare workers, and then moving on into everyone, basically. I mean, as the vaccine goes up, I know you've heard nationally that certainly a goal would be to get everyone who needs to be vaccinated or wants to be vaccinated by the end of the summer. And I've said certainly to our team, and I think in P.E.I. we can do this. If we have vaccine available, we are going to try to make sure we have all our vulnerable groups done that have been identified and that we're following national guidance on who those priority groups are. We will continue to follow that. We can get them done as soon as possible and start doing more general public as soon as we can. We all want this to happen as quickly as we get vaccine, and this will mean a different summer for us. So I think we're all very motivated, so we need to wait for vaccine. But the vaccine we get, we will make sure we deliver it. We know that when people get the first dose of vaccine, there is some protection that happens even after the first 2 weeks, after 14 days. But the most protection is after you get the 2 doses and at least 7 days after those first 2 doses. So this is a process, and as I mentioned earlier, it's going to be complicated, but I think we are definitely up to the task here in P.E.I.
I promise this one will be shorter for you. The Premier of New Brunswick, in an interview recently, said that that province wasn't really looking at opening up to the rest of the country until 70% of Canadians were vaccinated. I was just wondering if there's any discussions here about any sort of threshold of vaccination rates and how that might impact opening up beyond the Atlantic bubble.
I think I spoke about that. I mentioned that earlier to the Premier. I think we need to do this one step at a time, and the first things first, really trying to get the vaccine into people and available to islanders. But these discussions are happening nationally at all levels about some big policy decisions around how does the vaccine affect our travel, both within the country and outside the country, and as well as a number of other areas in terms of reducing restrictions, public health measures as we get vaccinated. I know we have said here that we would like to have 75 to 80% of our population vaccinated. That is certainly the goal. So we'll be continuing to have that conversation, but I think we know from what we know about vaccine and being able to protect those who can't be vaccinated, it's really important to have a certain level of our population vaccinated. So it's making sure our vulnerable groups are protected as well as a certain herd immunity for the population. And so we'll continue to have that discussion.
Gabrielle Dumont, Radio-Canada. Gabrielle Dumont, Radio-Canada. Laurent Rigaud, La Voix acadienne.
Bonjour, bonne année, Happy New Year. Dr Morrison, j'ai une question sur les vaccins. Vous venez de parler en anglais du niveau de vaccination qu'il faudra avoir. On parle de 70% à peu près. Est-ce que en juin, quand tous les groupes prioritaires auront été vaccinés, ça fera combien de pourcents de la population qui aura déjà reçu un vaccin?
Bonjour, c'est une bonne question. Je ne sais pas si on vient de calculer, mais et puis ça dépend tellement du nombre de vaccins qui soient disponibles par le printemps. Mais pour nous, et puis à ce moment, on fait les vaccins seulement aux adultes. Alors, je sais que on a vraiment besoin de vacciner à peu près 90 000 de personnes. Je pense que je fais les calculs dans ma tête, mais ça, c'est la population en général. Alors, je ne sais pas si on peut faire ça avant l'été, mais ça, c'est un but, mais ça va dépendre le nombre de vaccins qu'on a ici à l'île du Prince-Édouard.
J'ai juste un follow-up sur cette question. je crois, si je ne dis pas de bêtises, les enfants, c'est que les adultes qui vont recevoir le vaccin. Les enfants sont pour l'instant pas concernés. Et c'est justement pour ça que je vous posais la question, parce que si on ne vaccine que les adultes, il faudrait presque avoir, comme vous dites, 90-95% de la population vaccinée pour avoir 70% du total. Est-ce qu'il y aura un vaccin pour les plus jeunes? Est-ce que c'est prévu?
Je pense qu'à un moment donné, ça va aller aux enfants aussi, mais c'est pas encore. Mais j'imagine un jour, ça va peut-être être pour les enfants, mais pas à ce moment. Et on peut protéger nos enfants si la population d'adultes est vaccinée.
D'accord, merci.
Stu Neepy, The Guardian.
Hi there. Happy New Year, everyone. I guess my first question was for Dr. Morrison. I believe you'd mentioned truck drivers being moved, I guess, up into being vaccinated before the end of March. I think before they'd been listed in the April period in phase 2 of the vaccination plan. So I'm wondering why the decision to sort of move truck drivers ahead of, say, seniors who are 70 years of age and older.
Well, I think it's not, Stu, a question of moving one ahead of the other. These are hopefully being done concurrently. And I think this is an important point that we're trying to get to make sure it's reflected as well on our information. Just like we're trying to vaccinate our healthcare workers, and give them their second dose this week, as well as long-term care. So some of these are going to be done at the same time, and so absolutely that's a challenge. So we. And really, we're hopeful, again, depending on vaccine amounts and how it goes, that we will be able to start those who are over 80 by the end of March, as well as some of our truck drivers and rotational workers. We have talked right along for 10 months, Stu, about the risk of importation of COVID-19 into this province as being really key. And so our truck drivers, our rotational workers, are those who are important to this province. They are working elsewhere, but are based in Prince Edward Island, so we thinking about that risk. That is certainly something that I think everyone would understand. That we would want also to think about our rotational workers and truck drivers.
Okay, thanks for that. And I guess, I mean, you know, for the vaccine rollout, it is important for Islanders to have a bit of a timeline as to sort of which specific populations are getting vaccinated when. So I wonder if you can sort of set out which essential workers will be included in the second phase, you know, starting sort of early April.
So, Stu, that is actually a discussion that the national NACI, which is the National Advisory Committee on Immunization, is also looking at, so that there'll be as much as possible some consistency amongst the provinces and territories with essential workers in that Q2 phase of the vaccine rollout. And so I think that's important. So we're continuing to have those conversations and look at wanting to follow that national advice on that.
Just a last quick thing. By my rough back of the envelope calculation, the numbers you laid out for doses before, by end of March, it sort of looks like we'd be in the 10 to 15,000 person range in terms of number of people who'd actually receive the vaccine. Does that seem about right to you?
Yeah, I think it's just over 15,000 people before the end of March.
Okay, thank you.
Thank you very much to our friends in the media. Thank you both for all your hard work, and I hope you had a bit of a breather over the holiday, but it looks like we're right back at it. So, and good day and Happy New Year again to all Islanders. So thank you.